Dr. Victor, and I'll be taking a topic titled hypertension. I'll be discussing hypertension under the following outline: definition, signs and symptoms of hypertension, prevalence of hypertension, risk factors for hypertension, complications of hypertension, prevention and control of hypertension, as well as management. Now, when there is consistently raised pressure within the blood vessels, that means you probably have an hypertension. And with that aside, hypertension can also cause a damage to the heart muscle itself by reducing the amount of blood flow and oxygen being supplied to the heart. How do you now detect or know you have hypertension? A simple blood pressure check with a sphygmomanometer can detect your blood pressure. And if your blood pressure is 140/90 or greater than 140/90 persistently, you probably have hypertension. Now, the male to female ratio of those who have the disease is as follows. For men, we have 1 in every 4 men presenting with hypertension and 1 in every 5 women presenting with hypertension. What's the prevalence of hypertension? According to the World Health Organization, 1 billion people have been diagnosed with hypertension. And out of the 1 billion, we have about 22% of those who are affected about the disease globally. Under this percentage, Africa comes up with the highest percent of about 27, followed by Eastern Mediterranean with about 26. Next on the list is Southeast Asia with about 25, Europe coming with about 23, Western Pacific coming with about 19%, and finally leaving America with about 18%. With that aside, what could possibly be done to control or prevent hypertension? Hypertension can simply be controlled by 1. Strict adherence to counsel on hypertension by your healthcare provider. Secondly, a regular blood pressure check must be done for those who have hypertension, and also strict adherence to prescribed medications by your healthcare physician. And definitely you can also reduce or manage stress. Now, we move on to the prevention of hypertension. For the prevention of hypertension, it's simple. First of all, you have to reduce your salt intake to less than 5 grams daily. Secondly, eat fruits and vegetables in much or large proportions. Thirdly, avoid fat meals. Also, if you smoke or drink, avoid tobacco and reduce or limit your alcohol intake. And finally, physical activity is important to prevent hypertension. And now, what could be the signs and symptoms of hypertension? There are a lot of signs and symptoms of hypertension, but for the fact that most of these people who have high blood pressure may not actually come up with symptoms unless if the illness is severe. Now, the common signs and symptoms of hypertension could include a headache, chest pain, palpitations, and visual disturbance. Now, who are those who are at risk for developing hypertension? The risk factors for hypertension has been classified into modifiable and non-modifiable, but I'll be taking them together because of time. And now, those who are at 65 years or greater than 65 years pose a risk to developing hypertension, as well as those who have a family history of hypertension. They are also prone to developing hypertension. Now, there could be other illnesses that are associated with hypertension, such as diabetes mellitus, obesity, and chronic kidney disease. These illnesses have been studied over time to associate with hypertension. So if you have any of these underlying conditions as listed, you're probably at risk of developing hypertension. Now, we move on to the complications of hypertension. The complications of hypertension: first of all, you might have a heart attack. And secondly, you could come down with a stroke. Thirdly, you could have kidney failure. And the final complication could be death. Now, with that set aside, the World Health Organization has set up a system known as the heart. And heart is simply a technical package that is used to monitor or prevent cardiovascular system diseases in a primary healthcare setting. The acronym for the heart starts with H. H being healthy lifestyle and counseling. If people live a healthy lifestyle and are being counseled about the disease, it can possibly reduce the prevalence of hypertension. Also, we have evidence-based treatment protocols. For the evidence-based treatment protocols, it just simply means monitoring people who have been predisposed to the disease or who currently have the disease and being managed accordingly. Then also we have access to medicine and technology. Access to medicine and technology. People in rural areas most of the times may not be able to access drugs or may not be aware of hypertension. So if there could be access to medications in primary healthcare settings for people who are hypertensive, it could surely definitely reduce the prevalence for hypertension. Now, we also have team-based care. With team-based care, it just simply means each team in the healthcare providing services or rendering health services should just take it upon themselves to possibly educate the people about the disease of hypertension itself, and also to counsel them and possibly monitor them and prescribe medications for them for those who are hypertensive. And finally, we have systems for monitoring. If we could set up a system for monitoring those who have high blood pressure or hypertension, it will really go a long way, because once people come in for a routine check, you could easily pick those who are hypertensive and counsel them and possibly prescribe medications for those who will need those antihypertensive medications. Now, with all that said, I'll be coming to a conclusion, and I really hope that you are aware that hypertension is a killer disease and 22% of the world globally is affected by the disease. How can it be prevented? It's simple. Reduce your salt intake to less than 5 grams per day. Avoid tobacco smoking and excessive alcohol consumption. Avoid diets that are high in fat. Eat fruits and vegetables regularly. And also, if you are a known hypertensive patient, make sure you come for a regular blood pressure check. Stick to the medications as prescribed by your healthcare physician, and as well, try as much as possible to limit stress. With all that said and done, I will hope that this message about hypertension is well understood. And one more time, I'll be closing on this note. Make sure you go to every healthcare center or a hospital to get your blood pressure checked. If your blood pressure is greater than 140/90, you have to see your physician. But if it's less than that, definitely keep up with a healthy lifestyle. Once again, I'm Dr. Victor. Have a very nice day. Thank you very much.